into this virtual training information session. Thank you guys for waiting and joining us. I am so excited to show you our virtual trainer. Hi, hello, come on in. So the virtual trainer, it is a combination of the very best of what Remar Review has to offer. So when you purchase this program, you will get instant access. You will get instant access to this platform. Immediately, you will have your training center. Immediately, you're gonna have your report card, okay? These are just things that normally when you do an NCLEX review, you do not have these components, all right? And we wanted this program to make you feel like you had control of your learning experience. So your notes, your file vault, that's the way for me to communicate with you. But just on general, when you walk into the virtual trainer, you are going to understand that this is a program that was created just for you. Like a nurse, like myself, I created this in mind of you. Okay, this is your first time seeing it. Yes, you can get it on Black Friday from remarnurse.com, but check it out. Check out the Black Friday workbook. Most of you have downloaded it. This is going to be the 5-hour free NCLEX review the day after Thanksgiving, and it is going down. It is going down very soon. Experience how and why we're different, and also understand that this is a process that you can complete. So this is a perfect opportunity for you to still accomplish that goal for yourself. Download your Black Friday NCLEX review workbook, okay? I can't stress it enough. Get it and make sure you have it. Also, right now we've released the Quick Facts on Amazon. You can study Quick Facts, the book, the 5-star Quick Facts. You can get through that in 3 weeks. If you're thinking about getting something for a nursing student or your best friend, Quick Facts for NCLEX is perfect. Also, don't forget we have Quick Facts for Tees and HESI. This is the time to get all of the Remar Review products, because Black Friday is when we really slash the prices and we just make an effort to have everybody in our community be able to feel like they can afford something. So you're able to watch, just like you're watching now, you will be able to watch it the day after Thanksgiving. So have fun during Thanksgiving, that Thursday, and then let your family know on Friday you have a class to attend. This is where you will be able to do all of your lectures. So all recorded, everything is updated. I have so many lectures in here. Also, if you can see here, there is your practice exams and your homework exams. So right here, you will have access to your practice exams and all of your homework. And what I love about the virtual trainer is that it's constantly tracking you. It's constantly tracking you. So everything that you do in here, it's watching and it's saying, hey, you've completed this, you got this quiz, you got that percentage right. So it says here that I did some videos, but I didn't do some videos. Like, I just wanted you guys to have the best technology, and I wanted this to be the most advanced and progressive experience for you all. So right now we're getting a first look into the virtual. Let's click on the video so you guys can see kind of like what I've done. A baby can get from a 0 to a score of 2. So let's go through the categories and look at the characteristics. Right. So as you can see, this is going to be a direct way for you to get information, for you to get that need to know information right at your fingertips. I would say right at your computer. And you don't have to worry about now, oh my goodness, I can't make it to a live class, or I've been out of school for 10 years. Like, this is education, and this is made so with you in mind that it's simple and it's easy to understand. And I've supported you with graphics, I've supported you with music, I've supported like any kind of learner that you are. The virtual trainer covers you. Yes. So this is going on sale. The regular price of the virtual trainer will be $369. Okay, it will be $369, and that will be for the 6-week course. But for Black Friday, we are going to be reducing that price, taking $170 off. So it will be $199. It will just be $199, and oh my goodness. I just don't even know. $33 a week. What can I say? $33 a week. That's $4 a day. $4 a day. Somebody says, how much is the virtual trainer? The virtual trainer is $4 a day. Is that worth it for you? All right. So again, you have videos here. These are my newest videos. They were recorded. You'll see a big difference. We wanted to make it educational. We wanted to make it instructional, but we also wanted to make it non-boring. I'm just really challenged with the material. It is super boring. It's hard to remember. It's so confusing. And I just wanted something different. I wanted you guys to be able to get the information as quickly as possible so that you can start practicing questions. Okay. So that's the goal for here. So this live is really about the virtual trainer. And is it a complete review for NCLEX on the exam? Absolutely. Absolutely. This is the most comprehensive review that you have ever seen. And I'm really excited to release it. All of my schools and institutions and businesses are putting their students in the virtual trainer because they understand that at the end of the day, if students are not doing the work, if they're not interested and excited to do the work, they don't get their license. They don't get their license. Let me show you more features of the virtual trainer as well. So you saw the video. The video. Let me go back and show you guys the interface again. Your training center. Is great. I want to show you some of the other things that you get with the virtual trainer besides the videos, besides in progress exams. If you go to the main virtual trainer, your training center, these are some of the other cool things that you will get with the VT. Okay. Yes, this is 60-day access to the virtual trainer. And I just love it. At the bottom here, you can see the metrics that the virtual trainer gives you. So it literally says, okay, you have been signed in 6 times this month. Okay, 6 times this month. And that's how many times I've been in there. And it tells you how many quizzes that you have to, and it's keeping track of all of this. It even has the ability to say, hey, do you want to pick up where you left off? So the last 3 videos that I watched were psychiatric medication, psychological concepts, and normal and high-risk newborn, which I just watched. Like it already had logged in that I had watched those videos, and it's trying to encourage me to keep studying. Some of us need that encouragement, right? Some of us need that encouragement. Will keep you motivated to do so. So let's look at my report card. Oh my goodness. I love that the virtual trainer has a report card just for you. And out of every course that you take, you're able to go in. This is how many times you had to take a quiz. This is the grade that you got on the quiz. Remember, with the virtual trainer, my passing rate for all of the quizzes in the virtual trainer in your training center is a 95%. Yes, it's a 95%. So I'm looking for perfection almost from you guys in this process, because if you can't remember or if you can't apply the information, then I don't want you to just go on and keep on trying to study and memorize it. No, I want you to be excellent. I want you to master the information in here. So my report card is a way for us to determine that. So if you, let's just go to NCLEX review options that I've been working in. So let's go to my NCLEX RN Training Center. Right here on your report card, you're to the normal and high risk newborn exam. I took it on such and such date. I took it on November 11th. I got 100%. It took me one time to get 100%. So I took it one time. I passed it in the first time, right? With your NCLEX review. Let's see, what about that? My online homework. Look at the online homework, chapter 8, the online homework, psychological concepts. I took that in October. Man, look at my score right there. The virtual trainer is letting me know that I only got a 21% on that. And how many times did I have to take that? 6 times. And I failed it 6 times, right? So some of us Some of us need this kind of information. This is why schools love the virtual trainer. It has this level of accountability where you can't hide from it, right? So you can't hide from the VT. So when you're in here for 60 days. And of course, you can renew your access to the virtual trainer if it takes you longer. But the idea is that when you get into this program from second one, you are being accountable. This is for everyone who needs, this is for everybody who needs a virtual trainer in their lives. And you guys can tell me, do you need a virtual trainer in your life? I certainly loved the program when I thought about it, and I'm like, this is what nursing students need. So what I wanted to do is now I want to show you something else that I think is super helpful. It's kind of like the report card, but it's another way to have, accountability. And let me just see. All right, YouTube, you guys still with me? Somebody's like, I do need a virtual trainer. Okay, so I want to show you, it's called My Usage Report. My Usage Reports. So the usage report is generated at the first of every month. In the beginning of every month, it will literally show you the days that you have been studying and the days that you have not been studying. And I think a hard time sticking to a schedule, and we don't know like why we do good and then why we don't do good. So it's super beneficial to be able to look over your last week and say, hey, like you logged in the most weekdays after 9 o'clock, right? So when you attempt to study in the morning, you already know I'm not getting a lot of studying done. But the VT allows you to see, okay, when are your optimal times of studying? When are your optimal times of studying? Also, your training activity. How, are you making progress? Are you not making progress? Are you actually passing your exams? Are you actually doing what you are supposed to be doing? Let's go to the File Vault. It's a totally new element that I included into this program. So you guys know I'm constantly doing free resources. I'm constantly creating for students and creating for schools. And, sometimes it'll be like, hey, Regina, do you have anything extra on math? Do you have any priority questions? And so now I have a File Vault that will be yours. It will be yours. And so every time I create something new, I can put it in your File Vault. So like some people are like, hey, Regina, I don't have the Black Friday workbook. I can literally upload this document, this workbook into the File Vault, and it will go directly to you. So you won't have to look for it. Okay. So this is the things that I'm talking about. Like, this is why I'm so excited about the virtual trainer, and what we can, NCLEX resources right now. And I'm gonna be constantly adding stuff to this VT. Right now, what I have for you there is the weekly calendars. This VT comes with a calendar that is literally, it's a daily calendar, but I broke it down by the minute. So there will be videos explaining how you are to study every day. So it's even more structure in your NCLEX review. Yes, this is a 6-week program. If you want to extend, then guess what? It is a discounted price for renewals. You can make that decision. Right now, renewal for 30 days is $105. That's $3.50 a day. Literally, that's $3 a day if you go past the 60 days. But honestly, I made this program so that you can complete it. I don't want you to be in the VT forever. I really want you to use it the way it was supposed to be used, which is a 6-week program. So we're talking about the File Vault. And you can get this right on Black Friday. I mean, I love it because you can even reset yourself. Like, sometimes if you finish a program or a quiz and you want to just go through it again, you have like 20 days left in your VT, then you can reset yourself and make sure that you do it again. And so there's some serious control settings that I love about this virtual trainer is that you guys don't have to contact me and wait for everybody or wait for Team Remar to get back to you on changing your password. You can change your own password. You can reset yourself during your access time, and you don't have to wait around to get it done. So it just gives you more control. One of the things I love about the virtual trainer is all the control that you have. Does that sound good, everybody? So we're talking about virtual trainer. We're talking about how it's going to help you be more successful on your exam. So just one more time, I'm going to go into the training. I'm going to go into the training center. So right now, this is just a small progress exam for your maternal and child health. So let's try it, actually. Let's try it. And remember, I'm going to have Mark try it. Here we go. I'm going to have Mark go ahead and take this exam in front of the whole world to see if he actually has been studying. Who is Rh negative is seen by the physician during the first trimester of pregnancy. The nurse's teaching is effective if the client understands that she will first receive RhoGAM, or I'm sorry, it says Rh immune globulin at what weeks? At what weeks? When will you first get it, Mark?
I'm going to go with...
Okay, and there's a timer counting down.
28.
Is
I haven't studied the content.
You haven't studied the content? Oh man.
I guess 30.
Okay, so you didn't get it right. The correct answer is actually 28 weeks. You want to keep going?
One more.
Okay, want to do one more? Okay. All right. The nurse is caring for an infant with tetralogy of Fallot. Do you know that? Okay. There are signs of decreased oxygenation.
Okay.
The nurse is aware the goal of surgery to treat tetralogy of Fallot is to directly increase the blood flow to the brain, the lungs, the right ventricle, or the myocardium. Okay. And listen,
is that in quick facts?
Yes. No. Remember, you're taking this quiz after you have program. You should definitely know this answer.
What did they
period.
Say? I should have been listening. They said 28 on that one.
Yeah, they said 28. People were trying to give you answers, Mark. The counter is still counting down. So you better make the right choice.
Right, what is it, guys?
And these questions that I put in the VT, they are tough. I wanted them to be
B, C, or D.
Tough for you.
A, B, C, or D.
Help coming.
Oh, guys. Somebody got the program already? Somebody got the DVD? You know the answer. Know the answer.
Listen, Mark, you gotta hurry up.
All right, I see one person said right ventricle.
Okay, Barbara, so you're gonna go with right ventricle? All right.
Bob, we're gonna ride on this together. Hold on. I'll see. Okay, I see somebody else said C. Okay.
Oh my goodness. Listening.
Oh.
No, this is an incorrect response. Okay. The client will need to have increased blood flow to the lungs to improve oxygen. What color are you? Are you pink or are you blue?
That's a blue.
That's a blue baby problem. So you want to increase oxygenation to the lungs. Okay. All right, just try another one. Try another one. One more. Come on. The people said induced
hypertension is admitted to the maternity unit. The client asked the nurse, "Is my baby going to be okay?" The most appropriate response by the nurse would be, all right, I know you don't want to make promises like that. Let me see. Okay, a healthcare provider will tell us exactly what is going to happen. B, if you follow the medical instructions, all things will be well. C, the baby will be fine. It is protected inside the uterus. Or D, we are going to constantly monitor your baby while you are here.
Okay.
I'm going to have to go with D.
D?
I'm going to go with D.
Okay.
Let me see, because it doesn't give a definitive.
Like the people are agreeing with you, buddy. You might get this one right.
Hold on.
On your own. Yay! You did it, Mark.
Nice.
You did it. Okay, let's try one more.
This is fun.
Okay, this is fun. Here we go. One more.
And it also gives the rationale on that too.
Yeah, I'm proud of you.
Nice. All right.
Here we go.
Let me see. A nurse is caring for a child new from surgery. Following a tonsillectomy, the initial fluid the nurse should give the 10-year-old child is what?
Okay.
So what fluid does the nurse give the child following a
tonsillectomy? What is a tonsillectomy?
That is where you remove the tonsils.
Okay, perfect. So what is the first thing that you would want to give after a child has had this procedure? So think like safety. Think like, what is the first thing that you would want to give?
Okay.
Yeah.
You says do unto others as you would have it doing. I would go for the ice cream myself. But I don't know if that's what y'all think, guys.
What's this safe? What's this? It's safety. We're taking a quiz here.
Cream, C, warm milk. That sounds good. Or D, OJ, orange juice.
What about warm milk?
What do we have?
Stop looking at this on NCLEX. When you don't study the content,
you gotta guess. What strategy should I use for this one?
Okay, so here is where here's where we see whether strategies help you. Now look at Mark.
What strategy?
Look at Mark, a pillar, a perfect example of a student with no content trying to take this exam.
Oh,
okay, well he didn't know what a tonsillectomy was.
That's right.
So that's some content right there. So there you go. Now, what strategy?
Obstacles though. I don't know, but I don't know if it's the first thing.
That's true. See, but what do we say about doing what you see in the real world on NCLEX?
Yeah, let me see the question.
Okay. So here's the question.
I got 80.
You got 80 seconds left, brother.
Okay. You know what? If it said water, I'd be cool, but it says ice water. So I mean, all right, I'm gonna go with ice water. What y'all say? Y'all say A? I see a lot of A's, C's, B's. C. Come on, guys.
All
right.
What's the safest thing for the nurse to do? You got 58 seconds. Okay. Yes.
I'm gonna go with ice water.
You did it. Yes. Now, why? What? Okay. Go ahead. Okay. Read the rationale.
This is the correct response. Cold, clear liquids should be given first to promote. What is that?
Let me see. Vasoconstriction.
Mm-hmm. Okay, and decreased bleeding. Okay.
Yeah.
I like that.
Yeah. When you think about surgery, after a surgery, what do we want to give our patients first? We want to give them clear fluids. So even though most people see, well, you kind of said this because you said popsicles, which would be considered a clear fluid. But popsicles wasn't on there. So the closest thing to that would be the ice water. Okay. So we just have you taking quizzes, and we want to show you kind of exactly what it is going to be like when you're in the virtual trainer, right? When you're in the virtual trainer, and it's all just to help reinforce the content, because it's important that you understand that you don't have all day to answer these questions, right? So just trying to introduce you guys to the virtual trainer so that when you purchase it and when you get onto the virtual trainer, you can hit the ground and you can get started right away. Let's go to, how about the diets video? That's one of my favorites. I love to do it. And you guys know that if you have the DVD program, a lot of these topics are going to be in your DVD package, but this is just the new location for our online academy and hybrid DVD program.
Let's start with the easiest diet, the NPO.
So here I am, this is the virtual trainer because it's me
diet.
Giving you
the reason
information
why
right at your fingertips.
Prescribed to be NPO is to prevent aspiration before surgery. So if you're going for a surgical procedure and you happen to get nauseated by the anesthesia or the stress of the procedure, if you don't have anything in your stomach, you're less likely to aspirate. Another reason why patients can be prescribed NPO is to have bowel rest. That means you give your intestines a break from constantly digesting food. When it comes to the food, you cannot have anything.
So as you can see, the videos are re-recorded. The information is going to be updated, and it's going to have, the other features that will support you in your learning. And it's me. So it's the perfect combination of, let me show you guys. So I've tried to incorporate things for students where English is not your first language. You get a visual representation of what I'm saying all the time. And it's not you trying to guess or you trying to figure out. These are all examples of clear liquids. We were just talking about clear liquids. Well, here you go. All the clear liquids that you can associate with a post-surgical diet. So when you're talking about preventing dehydration, you get a feeling of what that looks like inside of the virtual trainer. You get a full understanding of the nursing process. Basically, I'm trying to tell you guys a story. And at the end of the story, you understand what it means to be a safe, clinically sound, critically thinking nurse. And that is the struggle, I think. That is the struggle with most NCLEX reviewers, is that they literally don't know how to tell the story of nursing. And so I have mastered this art of storytelling for you guys, and I want to bring it right into your home. So this program, there's no excuse, there's no reasons why you wouldn't pass NCLEX, because literally it has everything to support you, and there's nothing else like it. This is Netflix. This is Netflix for nursing. This is Netflix for nursing, okay? So I hope you guys really like it, and I hope that when Black Friday comes, you're excited and it's on your wish list, and you know, when you begin to study, it's like, oh, this is what I needed. This is what I wanted, because I've worked so hard on this, and I wasn't even sure if I was going to be able to release it this year. But again, here it is. It will be available to you guys Black Friday for $170 off of the regular price. And I'm telling you guys, this is a perfect opportunity for you to do it. All right. And so $369 is the normal price of this virtual trainer. And believe me, this virtual trainer is worth every dollar of the $300. It will only be $199. So if English is your second language, or if you failed NCLEX in the past, the virtual trainer is an opportunity for you to take control of your learning experience and really have that accountability. Like I said, one of the reasons why I moved away from the online academy that we had in the past is because I'm one of the NCLEX reviewers who I'm constantly updating, I'm constantly creating. And so I needed to have a place where I could send out one document and I know that all the REMAR nurses could get it. I needed to have a place where if I did a live review, I could put it in the live review section, or I could put it in your file vault, and I would know that all of my REMAR nurses had it. So if you want to know more information about the virtual trainer, your Black Friday workbook will have information about it. It will list all the features of it, the pricing. You can sign up for it with the code down at the bottom. Just scan it with your phone, and your products will be there. I see that we still need to buy a question bank. Check out, just hold on to that thought for the question bank. I do want to talk about it. I'll talk about it probably next Friday. REMAR Review is coming out with our own question bank as well. So hold off on thinking about question banks right now. All right. I don't mind question banks. I don't mind question more than ever. I'm working with a lot of students and a lot of schools who went to the question banks and their students are failing. Okay. Everybody has UWorld. Everybody has the Kaplan question banks, and they are not passing NCLEX. You guys have to get the content first. So I need to educate a lot of instructors, a lot of students on how we prioritize our studying. And at the end of the day, no question bank is going to compete with a comprehensive NCLEX review, period. But I got you on the questions because I know you guys want them, but right now I'm all about VT. I am all about the virtual trainer. And so that's what I want you guys to really have in your mind. Like, I need a system of accountability. I need a system that's going to teach me, and where even if I've struggled in the past with the subject, because look, I have the clinical math, I have, prioritization, I have the management of care. The virtual trainer has so many advanced clinical topics in it. I mean, it's just amazing. It's just amazing. So I know you guys are going to love it. I didn't even get to show you the interactive videos. We're still working on this. This virtual trainer has computer adaptive videos in it. But I'm telling you, Black Friday is going to be that time to get this virtual trainer. It's going to be that time. I'm telling you, take advantage of it. Okay. So once again, this will be the pricing. I'm telling you now, just so you know. Also, we'll be doing some pre-Black Friday releases. The first one that we have is the 5-star quick facts on Amazon. You can get it early right now. So if you have the quick facts before Black Friday, the VT is going to be even less for you. Right? There's going to be a price for it if you already have quick facts, right? So I'm talking about the virtual trainer. This was the informational session about it. I hope you guys found it. I will be doing this on Fridays, every Friday. So if you didn't have a question, but you need to have one for next week answered by me, think about it on Friday. I'll be going live in order to do it, right? So super excited about it. Again, Black Friday, we also have our NCLEX review for 5 hours. So make sure that you sign up, have this virtual trainer. I've never seen anything like it before. And so I want to just make sure that you guys take advantage of it. All right. So I will see you guys. I will see you. Thank you so much. Congratulations. I passed my NCLEX PN last Friday. Thanks for all you do. Quick Facts and DVD package helped. Yes, the DVD package, as we're saying goodbye to the DVD package, I want you guys to know that those of you who have it, who've purchased it years ago, you now have that information and it's yours. It's yours.